Welcome to the Pulse Report. I'm Dr. Shen, a cardiologist specializing in electrophysiology and the Director of Research and Education at Cardiovascular Medicine. Welcome to today's Innovation Update. In this episode, we are going to explore a new and very exciting innovation in atrial fibrillation treatment, combining two procedures into one, pulsed field ablation, or PFA, and the WATCHMAN device. This combined approach addresses two of the biggest challenges people with atrial fibrillation face, the irregular rhythm itself and the increased risk of stroke. By treating both problems in a single procedure, we are making care more efficient, more convenient, and potentially safer for many patients. Let's start by breaking this down. PFA is a cutting-edge way to treat atrial fibrillation. Instead of using extreme heat or cold, PFA uses short, high-voltage electrical pulses to very precisely target and disable the heart tissue that causes abnormal electrical signals. This makes the procedure faster and reduces the risk of damage to nearby structures like the esophagus or nerves. The WATCHMAN device addresses a different problem. In atrial fibrillation, blood clots often form in a small pouch of the heart called the left atrial appendage. If a clot breaks free, it can travel to the brain and cause a stroke. Traditionally, patients at higher risk of stroke are prescribed long-term blood thinners, but these medications can carry significant bleeding risks. The WATCHMAN is a small implant that permanently seals off the left atrial appendage, reducing stroke risk without requiring lifelong blood thinners. By combining PFA and WATCHMAN implantation in one procedure, we can help patients both regain a steady heart rhythm and lower their risk of stroke, all in a single visit to the lab. So why is this combination important? First, it is efficient. Instead of scheduling two separate hospital visits, patients have one combined procedure. That means less time in the hospital, fewer anesthesia exposures, and a quicker return to daily life. Second, it improves safety and comfort. PFA offers a more tissue-selective way of treating atrial fibrillation, reducing complications compared to traditional ablation methods. At the same time, WATCHMAN implantation reduces the need for lifelong blood thinners, which is a major advantage for patients who are at risk of bleeding or who cannot tolerate these medications. Third, it can have a real impact on quality of life. One of my patients, who was among the first to receive this combined procedure here in the Quad Cities, told me afterward, "I feel like a different person. I'm back to golfing and I feel great." Stories like his remind us that innovation in medicine isn't just about technology. It's about people regaining their lives. Now, who is this combined procedure best suited for? It is particularly appropriate for patients with atrial fibrillation who need ablation to control their rhythm and who also have a high risk of stroke. For example, people who have other health conditions such as high blood pressure, diabetes, or a history of stroke are at higher risk for blood clots in the heart. Traditionally, these patients would take blood thinners for life. For many, that works well. But for others, especially those who have had bleeding problems or who cannot tolerate the medications, the WATCHMAN offers a safer alternative. At the same time, ablation is often considered when symptoms such as fatigue, shortness of breath, or palpitations affect daily life despite medications. So, when a patient needs both rhythm control and stroke prevention, doing both procedures together makes a lot of sense. It is important to note, though, that not every patient with atrial fibrillation will need this combined approach. Some people do well with medications alone. Others may need only ablation or only stroke prevention. That's why a thorough evaluation with your cardiologist is essential. This innovation reflects a broader trend in cardiology, combining treatments to provide more comprehensive, patient-centered care. Research studies from around the world have already shown that both PFA and WATCHMAN are safe and effective on their own. Early reports and ongoing trials suggest that doing them together in one session is also safe and can be highly beneficial. Even health policy is catching up. Recent changes in reimbursement codes now recognize and support this combined procedure. That means hospitals and doctors are encouraged to adopt this approach where it makes sense. Here in the Quad Cities, Unity Point Trinity Heart Center and Mercy One Genesis East Medical Center are among the first hospitals in the region to offer this combined procedure, which puts our community at the forefront of AFib care. So, to sum it up, combining pulse field ablation and the WATCHMAN device allows us to address both the irregular rhythm of atrial fibrillation and the stroke risk it carries, all in one minimally invasive procedure. It is efficient, safe, and life-changing for the right patients. If you or someone you know has atrial fibrillation and is wondering about treatment options, talk with your cardiologist. Ask about rhythm control, stroke prevention, and whether this combined approach could be appropriate for you. Thank you for listening to the Pulse Report. I'm Dr. Shen, and let's keep your heart and your life going strong and in rhythm.